Thank you for joining us for today's edition of Mercy's virtual Health Talk series. Today, we have Dr. Maurice Chung, urogynecologist and director for Mercy Center for Endometriosis, Pelvic Pain, and Urogynecology. He'll be discussing female pain, more specifically chronic pelvic pain disorder. Dr. Chung has more than 30 years of experience helping women, including many who have struggled to find pain and symptom relief. Dr. Chung graduated from Northeastern University College of Pharmacy and received additional medical training from Tufts University School of Medicine. He received his postgraduate OBGYN residency training at Albany Medical Center and is currently a fellow of the American College of Obstetrics and Gynecologists, as well as the American College of Surgeons. Additionally, Dr. Chung has countless additional board associations, memberships, and awards. If you have any questions during this health talk, please be sure to leave your questions in the comment section below the post, and Dr. Chung will be more than happy to answer any and all questions you may have concerning female pain. All right, Dr. Chung, before we get into today's topic of chronic pelvic pain disorder, could you tell our viewers a little bit about Mercy's Center for Endometriosis, Pelvic Pain, and Urogynecology?
Yes, very well. And I am obstetrician and gynecologist, and I also was board certified in urogynecology and female pelvic medicine. So in my last 30 years of professional career, and I learned a lot about the female pelvic pain. And also I was very much proposed to have one of the best women's health center in Mercy Medical Center. The Pelvic Pain Center focuses on women from reproductive age or postmenopause. Any symptoms such as menstrual cramp, menstrual pain, painful period, painful sex, painful on urinations, urinary urgency frequency, lower back pain, and when the patient become older after they're done with childbearing, then they have all these incontinence issues. They cannot make it to the bathroom once they feel that they have to go. And also some of the women that notice that the pelvic organs fall out of the genital area. So these are some of the conditions we treat. And chronic pelvic pain is one of my main focus. And I found it very, very rewarding in helping out this group of patients. It's close to 1 in 6 women in America, and they cost almost $3 billion a year in taking care of them.
Okay, thank you, Dr. Chung. So let's get into the topic. What is chronic pelvic pain syndrome and how common is it?
Well, as I mentioned a little bit earlier, chronic pelvic pain means all pain below the umbilicus. So that includes the area in the bladder, the vagina, the lower back, lower abdomen. So for women's health, we know that endometriosis happens in 1 in 5 women, and 20 million Americans was affected by it. But then endometriosis is not the only problem that females face. So chronic pelvic pain, you would expect that's more than endometriosis because there are more other area in the pelvis. So you see how common is that? The statistics show that 178 million population in the world, 20 million United States women have endometriosis. So how common is that? That's very common.
Very common, yeah. Okay. What are the specific symptoms of the chronic pelvic pain syndrome, and are there specific risk factors for women to get that?
How common is that?
Very.
Very common. We talk about endometriosis. That's 1 in 5. So what are the symptoms patients have with endometriosis? Menstrual period that was irregular, painful sex, they could not become pregnant, and painful period, they call them almost like a dinosaur period, whatever that name that I learned from my patient. Just so bad, okay? And interstitial cystitis, painful bladder syndrome. That's pain when your bladder starts to fill up. You feel like you have to go to the bathroom to urinate, and you have pain. And again, that's probably close to 20 millions of population have that problem. So that's another one. Okay. And the symptom is urinary urgency, frequency. They pee so many times at night, and if they don't go to the bathroom, they hurt so much. And some patients actually urinate more than 30 times and 60 times a day.
Oh, wow.
Yeah, that's the bladder. What about pudendal nerve, pelvic pain? Those are the ones that will tell you, my right side hurt, my left side hurt. Oh, I cannot sit down. And because sitting is uncomfortable. Standing up is a little bit better, and lying down is more comfortable. So we have a lot of those patients that was in gymnastics, that was in ballet, there was a ballet dancer, or they actually have some injury that hurt their lower back, like when they were a kid, like tater-totter and all those bouncing back and forth, sometimes it hurt those nerves. And that's a big number. And so when you put all these together, these are some of those symptoms.
Okay. And are there, and you said like ballet and dance, are there any other risk factors that would make a woman more prone to have the chronic pelvic pain syndrome?
Well, chronic pelvic pain syndrome is just the perception of the pain that never go away more than 3 months. It doesn't matter where it comes from. So for those patients suffer from painful bladder syndrome, the pain spread from the bladder, goes to the other part of the body, and their symptom may be urinary urgency, frequency, and pain if they don't go to the bathroom.
Okay.
And then make the muscle spasm. Okay, so now you tell those patients, this is just your bladder. Well, maybe they have injury when they were a kid from gymnastics or sports. And then you hurt the pelvic floor nerves, and including the pudendal nerve. So those two are acting together and causing this long-term problem. And chronic pelvic pain, as the definition, means more than 3 months.
Okay. All right. And just a reminder to our viewers who are watching Dr. Chung's talk, if you have any questions during the health talk, please be sure to leave your questions below in the comment section, and Dr. Chung will be happy to answer those either during or following the program. All right, Dr. Chung, we've talked about the chronic pelvic pain syndrome. How is it diagnosed? How do you diagnose these conditions?
Well, it took me 30 years, and I'm still searching. And one of the things that I think is a misdiagnosis, I can share with that. When a woman after they have a childbirth, then they have pelvic pain. Then they develop painful sex. One side hurt more than the other, and the period becomes much heavier. And so the gynecologist, most commonly, would think that this is endometriosis. This is something that laparoscopy could help. Well, they could do laparoscopy, but they may find 1 or 2 spots of the endometriosis. So they could treat them, but the symptom never went away. So why was that? Because the misdiagnosis of the pain of a pudendal nerve injury during childbirth to be endometriosis. That's why these pain symptoms continue to grow. It doesn't stop because you never nail the right things down. Okay? And so if somebody who were a child when they have problem of wetting the bed, so then they progress getting worse, so the bladder symptom get worse, and they get older, the period getting worse, and then they think they have endometriosis and come along with some injury in sports. So that becomes the bladder problem, the menstrual problem, and the muscle and nerve problem. But for us as gynecologists, I can tell you that the residents were not taught with all these syndrome well enough in the training. So that's why it took me all that many years to trying to figure that out. And because of not one thing, it's multiple things. So these are the symptoms of chronic pelvic pain.
Okay. And once it's diagnosed, what type of treatments, medications, surgical procedures, therapies, what's used to treat the different aspects of the chronic pelvic pain syndrome?
Well, it depends on how many triggers you got. So let's make it the female reproductive system. Then you have the urinary system, and then you have the bowel, and then the neuromuscular.
Okay.
So to treat the female, it's the menstrual cramps and endometriosis is hormone and surgery. Hormones and surgery. There's no way around it. So for the painful bladder is medication, simple procedure, and sometimes nerve procedure like to modulate the bladder symptom. And for pudendal neuralgia, which is the type that patients sit down and hurt more, standing hurt a little bit less, and from childbirth injury or fall, and tied to the tailbone when you have injury, and you hurt all the other area too. So that usually is nerve block, and prevention.
Okay.
So don't sit on it.
All right.
Sit on the toilet seat. Then you don't sit on your nerve.
Okay.
Because those are the symptoms what patient told you. So there are certain things treating certain things. It's not surgery. Surgery is the last.
Okay. All right.
Yeah.
And with all these aspects of chronic pelvic pain, what happens if it's left untreated?
Even though you treat them, 50% of those patients have recurrence. Well, I call recurrence means they get better and then they're getting worse. So it's very important for them to understand that is, they are not abnormal. It's just the nervous system tend to remember things, okay? And if you don't treat them, 60% get worse.
Okay.
So for example, I have a patient that came from some doctor office and they have multiple laparoscopic surgery and want me to do another one. And just because my way of approaching is different, then they may not want to follow my algorithm. And those are the patients, it's pretty much mark my words, they're going to get worse.
Okay.
So the sooner you treat them, the sooner they get better because you don't let the nerve getting to be too wind up and too crazy. You know, let's say, for example, if you have a cut on your fingers, you don't touch it, you don't feel the pain after a short time. And now you have a cut in your fingers, and then you go run your finger under the running water, then you hurt, right? And then after you take it out, you just keep dapping it. So then this pain is going to last for longer and much longer.
Yeah, aggravating that nerve.
That's right. So if you have a condition, you treat it right in the beginning. You can abolish it sometime.
Okay, wonderful. That's great news. For any of our listeners out here who may have some of these symptoms that you've talked about, how do they know when it's time to call a doctor, to throw in the towel and say, okay, I've got to call my doctor? How do they know when it's time?
They have pain. And if it's a menstrual pain, after you take the birth control pill, then the most common suggestion by gynecologists is have a laparoscopy to find out whether you have endometriosis.
Okay.
But even though you find out that is endometriosis, and after the first surgery, you don't get better, and it comes back, that is the time to go and find out. Or we'd be glad to help you right from the beginning. And for patients with pudendal neuralgia, which is the type of pain that you're sitting that hurt, the muscle in the pelvis was very tight, and they went through physical therapy. Sometimes I get a referral from physical therapy because physical therapy helps some, but not all of the above.
Okay.
Okay? Those patients have urinary urgency frequency. They think that they have bladder infection, and they keep getting bladder infection. But it's not an infection. It's the nerve that winds up. And when they wind up, then they started. So the second time, there's no bacteria. So this is another condition that make those patients and to continue to get worse and to the point that is unbearable. Okay. And I have patients that could not even sit when I was interviewing them.
Oh.
Yeah.
Well, Dr. Chung, I want to thank you for being with us today, and I want to thank you for all the work that you're doing to help alleviate women's pain. Again, for our viewers, if you still have any questions that maybe were unanswered or additional information, please feel free to ask your questions in the comment section below, and Dr. Chung will be more than happy to answer those. If you would like more information on Mercy's Center for Endometriosis, Pelvic Pain, and Urogynecology, please give them a call at 330-489-1379 or go to our website at cantonmercy.org/urogynecology. Thank you for tuning in for Mercy's virtual health talk session.